Hey, it's Dr. Kyle. I wanted to talk about the exercises that we just went over and specifically what we're going to be looking for. So we want to make sure that you're doing those correctly to target the low back pain that you're currently having. It's going to help to stretch. It's going to help to strengthen certain components of that low back pain just to give you some relief in the intermediate, and then we'll work on strengthening that back up once the acute pain starts to go away.
So the first thing we're going to do is the glute bridge, and so what we want to focus on is getting that low back flat against the ground. Once we do that, we contract the core and tighten it, and then from there we're going to lift up. You're going to notice that my hips are only going to be able to come to here if my low back and my core are contracted. I do not want this movement to be all the way up here because then that's a glute dominant exercise versus flattening that low back, tightening that core, and then lifting, okay? And then the variation off of this one, the next thing we're going to do is once we get strong with this movement, we're going to bring one leg up straight. Same thing, we're going to flatten the low back, contract the core, and then we're going to lift, and then we're going to repeat that movement. Okay, sets of 10 are what we want to focus on these, and then we'll switch, go to the other side, flatten, contract, and then we're going to be lifting that hip and those pelvis off the ground. And then lastly, what we'll do is we'll take a band, okay? We're going to put that around the knees, just like so. The movement in the low back is going to be the same. We're going to flatten the low back, contract the core, put some pressure out on this band, and then lift, and then go back down. Once again, repeating with sets of 10 on these in order to strengthen that low back and those deep pelvic muscles.
All right, so the next exercise in this series is going to be focusing on that hip. And so what we want to do is the feet are going to be together, and this is called the Clam. So this is the first movement of Clam, is we're just focusing on bringing that up while keeping that hip nice and straight here. We want to focus on not opening that hip up, but keeping it stationary as if there's a rod through my hip and it doesn't move. So that is that version, okay, is the first one we want to do, and we're going to do sets of 10 on this as well. Then the next one, you're going to notice the feet are going to come up, and then we're doing that exact same movement without moving the hip, focusing on opening that hip, isolating your glutes on the backside, and working to strengthen those abductors and adductors on that inside, okay? The last version of stepping this is what we want to do is we want to stay here, and then we're going to bring that foot out. We're going to bring it back in. We're going to bring it out. We're going to bring it back in. Once again, sets of 10 on this, and then once I finish this side with all three of those movements, we're going to move to the other side and strengthen on that opposite leg. All right, so the next advancement is all on the strengthening side of what we want to do here. So legs are going to be nice and straight. Once again, that rod and that hip to keep that hip nice and isolated and in place. So what we want to do is we're just going to keep the toes pointed straight ahead, and we're going to lift it straight up as high as we can go, and then back down. Once again, repeating this with sets of 10 on each side. Then what we'll do is we'll move into the toe pointed down. Motion is going to be the exact same. This is going to be isolating different muscles in that glute in order to work to strengthen them, which is going to give us that stability in that pelvis and that low back. Then what we'll do is we rotate that toe up, and we're going to be focused on the same exact movement, keeping my hip in this location of where we want it to be, so that way we don't rock that hip front or backwards. Last thing what we're going to do is we're going to do toe taps, okay? So what we're going to do is we're going to bring that to the front, then we're going to tap to the back, okay? 10 front, 10 backwards on this one, okay? Working that range of motion of the hip. If it's easier to come further back and you can do that, please do. If we can come to the front, same thing, okay? And then the last ones, we're going to do circles forwards and backwards. So we're going to bring that leg up, and we're going to go on a small circle in one direction, 10 rounds. Then we switch it, we go backwards. And then what we want to do is do big circles, okay? And you're going to notice that that hip and those glutes are going to get pretty tired going in front to back. So if we start this and we're only doing 5 because of the fatigue in those hips, that's totally fine. We want to build up to doing 3 sets of 10 on this in order to isolate and strengthen the glutes, which gives us that low back stability. Now this is going to be the variation in the building blocks of what we just went through. And so when you look at it, we're going to be taking a stair in the house, anywhere where you can get that foot up just slightly, 6 inches to a foot off the ground. Make sure you have something to stabilize yourself from the side if we have balance issues. What we're going to do is we're going to keep the hips nice and stable. We're going to bring that foot straight out, toe straight ahead. Okay, doing sets of 10 on this one. Then I'm going to turn that foot in and be doing the exact same exercise, going out to the side. Then we'll bring that toe out. We're going to do that exercise again, sets of 10 on these. Then we're going to do toe taps where we're coming front to back with that. Okay, once again, sets of 10. Then we're going to come out to the side. We're going to do those small circles clockwise. Then we're going to do them counterclockwise, and then try to do nice big circles with that leg while watching your balance, forward and backwards. And then once we're done there, we're going to switch to the other side, making sure that we're strengthening both sides of the glutes to stabilize that low back. So the videos and the exercises are baseline exercises for you to do. There's advancements to those, there's ways to make them easier, but the only way that we're going to know that is if you ask specifically for variations and things to make it easier for you or harder for you. And so please reach out to the office, give us a call, email us. We'd love to answer the questions so that way the exercises work for you. And then we look forward to you being in the office soon.